So you have a bad cold and you are trying to figure out if you should go to work or not. And if you see patients with cancer, this further complicates the matter, as many of them may be immune suppressed, and you certainly don't want your health, or the lack thereof, to put their health at risk while they're in or recovering from cancer treatment. So what guidelines should you follow if you, the rehab therapist, is sick? Welcome to the Tip Jar. I'm cancer rehabilitation specialist, Dr. Leslie Waltke. Here are my recommendations on how to manage your cancer rehab caseload when you yourself are sick. First, if you have a fever, you should stay home. If you have a fever, your immune system is fighting something significant, and you do not have the right to share it with others. Stay home and take care of yourself. If you have patients with cancer on your clinic schedule for that day, have your receptionist call them to reschedule or switch them to another qualified therapist if the patient agrees. I never recommend moving a cancer rehab patient to someone else's schedule without the patient's knowledge and permission. It will make them rightfully cranky to show up at your clinic wanting and expecting to see you, only then to be notified someone else they don't know will be seeing them. Second, if you are sick or getting over being sick, but do feel well enough to go into work, review your patient schedule for the day and highlight the patients you know or suspect may be immune suppressed. Then either you or your receptionist should call them to let them know you will be in the clinic today, but are fighting a cold. Give them the option to either come in or to reschedule. But it should be the patient's choice based on what recent instructions they've gotten from their MD and their own personal comfort level. If patients do come in, obviously, as always, wash your hands before and after each patient. Do your best to stay at least 6 feet away from your patient as much as possible, as the Centers for Disease Control estimates this is the typical range in which most microbes can travel through breathing, talking, coughing, and sneezing. If you need to be closer, as in the case of manual therapy or hands-on care, I recommend you wear a mask. Wipe down surfaces with sanitizing wipes frequently, and then of course remind your patient to wash or gel their hands with hand sanitizer on the way out. And please remember, going to work when you are sick does not make you a hero. According to the archives of occupational and environmental health, if just one employee goes to work sick, their germs can be found on 50% of all communal areas within 4 hours. Gross, but true. I'm Dr. Leslie Waltke. Thank you for joining me for this episode of the Tip Jar. I'm now off to sip some hot tea. Have a great day in the clinic.